two leading heart organizations issued new guidelines this month for preventing heart attacks and strokes. The recommendations are designed to help doctors determine who might benefit from taking cholesterol-lowering statins. But the changes are leading to confusion and controversy. So Dr. David Agus is here this morning to help sort this out. Doctor, good morning.
Good morning.
First of all, what's the confusion all about?
Well, the confusion is there's a calculator built in to say what is your actual risk, and the calculator was a little bit off. And so unfortunately, that calculator mistake is making everybody talk about it in a negative sense. Remember, these happened because over the last 10 years, a lot of people had said, well, statins don't make you live longer, they have side effects. And now the definitive data clearly show that the benefits dramatically outweigh the risk for most people.
It's certainly an odd thing to see the American College of Cardiology on the defense, defending all these things. Who should be taking statins then? What's the finding on that?
Well, that's the key question, is that anybody with a risk factor greater than 5% for heart disease, which is most people in the country, need to have the discussion with their doctors about taking these pills over the age of 40.
I was going to say, I walked in the green room this morning. You said, how old are you? I said 38. You said you need to start taking statins in 2 years.
You got it.
Why is that?
Well, listen, I mean, they have a dramatic effect in terms of delaying heart disease, stroke, and now also data on cancer. And so the goal is, obviously, with all that's talking about in healthcare, is to prevent things. We prevent disease, we're all going to live longer and better.
Okay, so what are the side effects, though, that you mentioned?
Well, the side effects are real. They cause muscle aches is the dominant one. And if you have it, you stop the statins. In a day or two, those muscle aches go away. So the risk benefits are different in each person. And I really want the conversations to happen between each of us and our doctors.
Are the drug companies pushing statins, though, too much at this point?
Well, listen, that's what everybody says. But in reality, there are 5 of the statins that are generic. So for $10, you can get a 90-day supply. So these are not a big benefit to the drug company's earnings. They're a big benefit to each of us.
And we should point out the fact, I guess we should ask you, do you have any financial stake in this drug?
Well, it's a great question, and the answer is I don't. I am not involved with any drug company or any statins. I'm doing this because twice a week I look at someone in the eye and say, I've got no more drugs to treat your disease. I don't want to do that anymore.
What about the issue of using this as a security blanket? I mean, there are some people who say, Nora was saying this the other day when we were talking about this, you know, like, oh, this is a 2 Lipitor meal, right? I mean, is that's really not necessarily the right way to approach it if you're using it to guard against a big meal?
No question about it. The primary defense is good health habits, good diet and exercise, and then statins on the side.
All right, Dr. David Agus, we'll get Jeff some statins.
Yep,
soon enough.
Got a couple years to go, but I'm ready. Thanks,
Thank you so much for
Doctor.
joining us.
Thank you, guys.